Welcome to Antenatal Faith Clinic. On this channel, I bring you interesting topics related to pregnancy, labor, childcare, reproductive health care teachings for all ages, as well as healthy tips for those who are trying to conceive. If this sounds like what you've been searching for, if this sounds like what you love to hear always, please click our subscribe button, hit our notification bell so you get notified anytime I post in new videos. In today's video, I'll be sharing with us a very important topic, highly sensitive because it's not often preached. People don't talk much about it because how highly sensitive this issue is. For me, I don't like using the word infertility. I prefer using the word delayed conception. You know why? Because my holy book tells me that none shall be barren in the land. Just as many people perish for lack of knowledge. In this video today, I'll be sharing with us in details, in the simplest form of terms, what infertility is and what you need to do about it. The problem now is a lot of people don't even know that they have a problem. But you know what? When you understand that there is a problem, you understand the actual cause of that problem, you'll be able to navigate through it and get solutions to the problem. It can be so devastating for a couple. After wedding, a year, 2 and more, they are not able to conceive. The society, friends, people around are so concerned to the point they even go to ask questions like what the problem is. It can be so frustrating. If you have not been in that shoe before, you won't understand. And so a lot of people blame the woman for being the sole cause of infertility. The size of the penis is not a determinant factor of one being fertile. How active you are during sexual intercourse is not a determinant factor of fertility. So then, what is infertility? Infertility is a situation when a couple fails to achieve pregnancy after 1 year of regular, uninterrupted sexual intercourse. Infertility affects several millions of people. It could be primary, it could be secondary. It is primary when this couple has never, even for once, achieved pregnancy. It is termed secondary infertility if they have ever been pregnant before, whether or not they carry the pregnancy to term. Or they gave birth to one child and after that child, they keep trying for a long period of time. This one is termed secondary infertility. Knowing the cause of a problem gives you clarity to the problem, direction, and then a ray of hope to seeking solution to that problem. Now, what are the causes of infertility? The cause of infertility could be from the male factor, the female factor, combined factor, or an unexplained factor. Now, for you to understand this term called infertility, I want us to go down to explain the process of fertilization. Maybe after this brief explanation on the process of fertilization, you'll be able to understand what exactly is the cause of infertility and then you seek help appropriately. The female reproductive system, we have the 2 ovaries, we have the fallopian tubes, and we have the uterus, we have the cervix, and then we have the vagina. The ovaries produces the female gamete, which is known as the egg. The fallopian tube provides passage for the egg. The uterus is the womb, forms a house where the developing baby stays. Now, the cervix and the vagina create the passage for the baby or the contents of the uterus. Every month, the ovaries releases an egg. And this is what we see and we say we are ovulating, right? So now this egg that is being released passes through the fallopian tube and stays there, waiting for a possible sperm cell for fertilization. Now, if it stays there for a while and there is no successful sperm that reaches where it is, it will now come out as menstruation, which is what I usually call the tears of a disappointed ovary. But then, if the sperm successfully reaches where the egg is patiently waiting, the both of them unite, form one cell, and then they begin to move in harmony until they bounce into the uterus, embed there, and the baby will start forming. Every female have the number of egg she will produce throughout her lifetime. As soon as she attains puberty, each month she releases an egg until she attains menopause. As she gets older, the number of this egg reduces, thereby reducing her chances of conception. All these processes are controlled by hormones. Hormones are those chemical substances that tells your body what to do, what not to do, when to initiate an action, when to stop, and when to increase an action. These hormones are produced in the brain and as well as the ovaries. That is why it is very important for couples who are expecting to do a hormonal test. Now, an intercourse. When the man releases the sperm on the vagina, these sperms are in their millions and they start swimming. Swim through the uterus. Their target is that egg that is being released at the ampulla of the fallopian tube. Millions of sperm released. Some die on the way, some become distracted, some become so weak, some will get to their destination. But you know one funny thing? It is only one victorious sperm cell that has the good characteristics that will be able to penetrate that egg. And once it penetrates that egg, the egg will now form a barrier that will make every other sperm cell that successfully gets to her unpenetratable. So that one that finally unites with her is the victorious one. And then when they unite, they form one cell and then travels back to the uterus and start growing there. So, a healthy, good number of sperm cells, free and smooth female reproductive system, plus a good hormonal signal with frequent unprotected sexual intercourse leads to fertility. Now, what are the main factors that causes infertility? Of course, when the sperm count is low, fertility is reduced because of the challenges this sperm cell will encounter as they swim through. Low sperm count is a cause of infertility. Undistended testes can also be a cause of infertility because the testes naturally is supposed to be outside the body, because the sperm producing cells of the testes do not tolerate a high temperature. So that's why naturally God has made the testes to be hanging outside the body. So for some people who have a congenital abnormality whereby the testis is within, is still inside, the chances of being fertile is reduced. That is why when a male child is born, we examine the two testicles for an undistended testis. When there's a trauma to the testis, when there's overheating of the testis, for people who like wearing tight pants, you are reducing your chances of being fertile. Naturally, the testis is supposed to be cold, to be in a cool environment. But when you are wearing, overheating your testis, you are reducing your chances as a man from being fertile. Also, congenital abnormalities of the penis can also cause infertility in a situation where the external urethral orifice of the penis, like the opening in the penis, is not where it's supposed to be. Maybe it's somewhere below. It can cause infertility in the man. Now, what are the female factors of infertility? Conditions that interfere with the release of an egg automatically is a cause of infertility. Conditions like polycystic ovarian syndrome, a situation where the hormones responsible for ovulation is absent. When these hormones are absent, the lady cannot ovulate, the egg cannot be released, fertility becomes an issue. Or in a situation where there is a premature menopause, there are people who go into menopause prematurely. It could be hereditary, it could be genetic. When there is hormonal imbalance, it can affect the release of an egg. When there is surgical removal of the ovaries, of course, when the ovaries are not there, no eggs can be released. Another female factor is tubal blockage. Like I said, anything that affects the normal free movement of the egg or even the fertilized egg can cause infertility. Sexually transmitted diseases, pelvic inflammatory diseases, gonorrhea, chlamydia, all these infectious diseases can cause a blockage in the tubes. Complications from an abortion can cause tubal blockage. Also, surgeries that are done around the tube can cause adhesions and then the tubes will remain blocked. A normal womb has to be empty and smooth. So anything that alters these characteristics of a normal womb will affect fertility. In a situation where the uterus is having another content, of course, survival of a fertilized egg becomes an issue. In a situation where the uterus is rough, implantation becomes an issue, and then fertility becomes a greater issue for that individual. So things that can alter these normal characteristics of the uterus include complications from an abortion, fibroid, tumors, adhesions, surgeries. However, not all cases of fibroid causes infertility. It depends on the location of the fibroid. Of course, when the womb is malformed, fertility is a big challenge. The cervix and the vaginal pH of the woman should be within normal range. If the mucous secretions in the vagina is too thick, of course, this sperm will find it very difficult to swim through because of the thickness of vaginal secretions. Conditions that can cause vaginal thickness is infection. Hormonal imbalance can cause thickness of the vagina. A normal vagina is expected to be moist, slippery, so that these sperm cells can swim through freely without any obstructions. And what are the combined factors? Combined factor could be the age of the woman or the age of the man. As one advances in age, the chances of fertility drops. Occupation: an athlete, a driver who sits for a long period of time is at risk of having issues with fertility. Lifestyle and habits: people who smoke, take alcohol, abuse substances are at risk of having fertility issues because these things they take weakens the sperm cells of the man. There are factors within the environment that can cause infertility. Substances from heavy metals like lead, or someone who works in a very big industries where all these toxic fumes are being produced. These These dangerous chemicals reduce sperm quality and then making fertility an issue for that individual, male or female. It takes two to succeed. Working as a team gives faster and better results at a faster rate. Don't cast blame on each other. Discover the cause of the problem and support each other to get solutions. If this video was interesting to you, please click the subscribe button, hit our notification bell so you get notified anytime I post in new videos.